to the demo.
This is really good. Did you ever want to see auscultation? And I don't mean this here, which is a phonocardiogram, which many of you have seen before and which are rarely used. I mean this here. Mitral regurgitation, as you can well appreciate from this image, is easy to diagnose if you see it versus hearing it with auscultation. And if you have both on board, that would be ideal. With echocardiography and with visualizing the jet, we can get a lot of information. I'm freezing the image now during systole, and right at that instant, we have mitral regurgitation. You see the jet right here from the left ventricle into the left atrium during systole. So what else should it be? It must be mitral regurgitation. If you freeze during diastole, right here, we have no jet. We have a little bit of inflow, red color here right into the left ventricle, but definitely no regurgitation. It's important to understand that we can use echocardiography in many ways to look at mitral regurgitation. Not only the jet, not only the severity can be assessed, but also the morphology. This is a 3D echocardiogram which beautifully shows you that there is a large coaptation defect right here in the center of the valve between the anterior and the posterior leaflet. So sometimes, even with 2D imaging, you can see the defect in the mitral valve. But before we come to the morphology of the mitral valve, I want to first explain the components of the mitral regurgitant jet. If you look at this jet here, we have an inside region, which is greenish, which denotes an area of higher velocity. Often you would have a mosaic color. Of course, it depends on the color map you're using. And then we have a region outside here, which usually has one distinct color, blue, because flow is away from the transducer. And then in addition, we have an area right here, which actually occurs before the mitral valve, which we call flow convergence zone. This zone will be very important when it comes to quantifying mitral regurgitation. Now, the jet can look very different, not only depending on how severe it is and in which direction it goes, but also which machine you're using, which color map you're using. Here is a mitral regurgitant jet recorded with different machines, and you see that the color maps look a little bit different. What is the tip I would give you here? Well, get used to your machine and kind of always use the same setting, otherwise you'll be off. Because obviously the setting of the machine makes a large difference with respect to how the jet appears. Mitral regurgitant jets can have very large different appearances depending on the underlying pathology. And you can see them in many views. Here, for example, on the left in a parasternal short axis view where the jet comes from the commissural region, or here in a parasternal long axis view. It's possible to see mitral regurgitation in transesophageal echocardiography, such as this example shows, where the jet is very, very eccentric. One can see mitral regurgitation from apical views and detect that they are very eccentric, in this case impinging on the anterior leaflet and then the anterior part of the left atrium. Some jets are central, as this example shows of a patient who has severe left ventricular hypertrophy. Some jets are very easy to see. Here's a patient who has a very large atrium and a huge mitral regurgitant jet. And in some patients, it's sometimes even difficult to detect mitral regurgitation and to quantify it, as this example of a patient with a high heart rate shows. We see patients who have more than one jet, and the duration of regurgitation can vary greatly. On the left, a patient who has regurgitation only during mid and late systole, while the patient on the right not only has regurgitation during systole, but even during parts of diastole. So mitral regurgitation can be very, very variable. We've covered mitral regurgitation in the previous chapters. Here is a very short review of what you've learned so far. Red would mean flow towards the transducer, and blue away from the transducer. The lighter the colors, the higher the velocity. And if the velocity exceeds a certain limit, then we get a mosaic or a mixture of different colors. In structural MR, you have some morphologic abnormality of the valve, while in functional MR, the valve is structurally normal, but something has happened, let's say a dilated ventricle or some other problem that causes leaking of the valve. So putting all this together, what do we have? Well, we have trace MR here. We have probably mild MR here, moderate, and finally severe MR. Okay, so now it's time to learn something new. We'll cover why patients have MR in the first place, how severe mitral regurgitation is, and what the consequence of our diagnosis is. Let's start with a short case. A 46-year-old accountant comes to the emergency department with shortness of breath and orthopnea. When asked, he says that he had a flu a week ago and that he just simply cannot breathe normally now after that flu. We perform an echocardiogram, and this is what we find. Is mitral regurgitation severe? Is this his problem? Clearly there's a jet. But how do we quantify this, and what is the meaning of this echocardiogram? Let's take a short look at the jet. As mentioned previously, some jets are very, very eccentric. You see that it impinges here on the intraatrial septum, and in essence doesn't look very broad. However, and this is the key point, this part of the jet is rather large. This is the flow convergence zone. Now, my estimate would be this definitely is severe mitral regurgitation, and it is probably his main problem. And there's another finding, but we'll talk about that finding later. First, I want to explain why this jet is severe, even though it doesn't look as if it's severe. Look at this video and see what happens. Now, this ping pong ball is put into the stream of air generated by a vacuum cleaner. And you see that the ping pong ball doesn't fall down, but that it moves with the stream of air. This is caused by the so-called Coanda effect, which means that the flow of air passes alongside this ping pong ball and causes negative energy. And this suction drags this ping pong ball towards the stream of air, and thereby we have negative energy, and we have kind of a friction between the ping pong ball and the stream of air, which in essence also reduces the energy of the jet. And this is exactly what happens in the case of mitral regurgitation with eccentric jets. Part of the energy is lost into the wall in which the jet impinges on, and thereby the stream looks less than it is, and we seem to underestimate the severity of mitral regurgitation. So the first rule of this lecture is we underestimate mitral regurgitation in the setting of eccentric jets. But how do we quantify regurgitation then if we have eccentric jets? By the so-called flow convergence zone. We talked about that zone already. Let me show you once more. This is a still frame of an eccentric jet. What we should look at is exactly this region here. You see that there all of a sudden is a change in color from blue to orange, which means that we have an increased velocity right at this outer shell. Why do we have such a flow convergence zone? The following video will show this to you. This is a sink filled with water, and now we're pulling out the plug of the sink. And you will now notice that water is streaming to the opening, and that the flow of water increases in velocity the closer it gets to the sink. If you know how high the flow of velocity of the water is, then you can actually estimate how much water goes down the sink, and essentially even how large the opening of the sink is. This is the principle of the flow convergence zone, and this is what you should be looking at on the echocardiogram as well. The truth is that it is often easier to see the flow convergence zone than the jet itself, because especially if you image from a transthoracic approach, this flow convergence zone is closer to the transducer and before the mitral valve. Here is another very important part of the jet that I want to show you so that you can quantify regurgitation. And that is the so-called vena contracta. Now I will freeze the image right at the moment when the jet is in its largest extension. And the vena contracta is the portion of the jet where it passes right through the orifice in the mitral valve. In other words, this is the region where you have the hole, somewhere here. And by measuring this distance, you get an approximation for the defect of the mitral valve, for the so-called regurgitant orifice. Another very important part of the jet that you should consider when you quantify regurgitation. Here are some values that you can use. Now, I personally don't measure the vena contracta, but so that you get a gross approximation of how to use this width, here is what you would find in the literature. Mild below 0.3, moderate between 0.3 and 0.7, and more than 0.7 would denote severe mitral regurgitation. So here is rule 2. Look at the proximal portions of the jet to quantify mitral regurgitation. Let's forget about color Doppler for a second. Just concentrate on the 2D image. The first finding we have is that of a mitral valve pathology. Just look at the leaflet here, and the posterior leaflet, it's definitely thickened. But I want to focus more now on the left ventricle. See how hyperdynamic the left ventricle is? Why is that so? Well, because we have volume overload. Volume overload simply means that the ventricle has to generate more output because it is losing part of the blood back into the left atrium. So in patients with mitral regurgitation, you will have two distinct features, that of a dilated left ventricle and a hyperdynamic left ventricle, in other words, elevated ejection fraction. The exception only is acute mitral regurgitation. In this case, the patient did not yet have time to adapt and did not yet have time to dilate. These patients, however, will have very, very hyperdynamic left ventricle function. And this brings us to the third rule of this chapter. Expect a hyperdynamic and dilated left ventricle in chronic severe mitral regurgitation. Good. You've learned how to quantify the jet, so I think it's now your turn to tell me, or tell yourself actually, how severe mitral regurgitation is. Here are 4 examples, and I would like you to rank the degree of mitral regurgitation from 1 to 4. Here is the first example. Okay. Look at the jet. This is the second example. Third example. This is a nice jet, I would say. And here is the fourth example. And here is the answer. Obviously, this jet is very, very little. This is, at best, mild mitral regurgitation. A little bit more, maybe. I would quantify it maybe mild to moderate. Moderate mitral regurgitation. Much more regurgitation here. And definitely, this is the patient who probably has the biggest problem because he has a broad jet. Remember, in this case, we probably even underestimate the severity because it impinges on the left atrial wall. And the important finding here is that of a very large flow convergence zone. Also compare the flow convergence zone from this patient to this patient. Here it's barely visible, maybe very small. You definitely don't even see a flow convergence zone in this case and in this case. So with the few rules I showed you, it's quite easy to quantify mitral regurgitation. Don't be put off in this case by the poor left ventricle function here. This patient has dilated cardiomyopathy, and therefore he has mild mitral regurgitation as a secondary finding. Now, another example. Tell me which of these patients has significant mitral regurgitation. And by significant, I mean regurgitation that in some way causes symptoms or could lead to a problem or changes or alters prognosis. This patient, this one, or this one, or maybe more than one? Well, yes, all of these patients have a degree of mitral regurgitation which will somehow affect the patient. Here I would quantify it as moderate. This is probably a little bit more than moderate. You can see that the patient also has some degree of mitral stenosis. There is a candle flame phenomena here. Remember, we learned that in the previous chapter. This is a broad jet, patient with dilated cardiomyopathy. And here we have a patient with a rather difficult to quantify regurgitant jet, but look at how dynamic, hyperdynamic the left ventricle is, and again, look at the flow convergence zone. The jet here is not visible, but here it is. And finally, here are 4 patients, and there is one patient which does not have significant mitral regurgitation, and I want you to find that patient. I think this is relatively easy. Broad jet, very large flow convergence zone. Also relatively broad. We can see that there is a flow convergence zone here. Here we have another patient with a flow convergence zone, and there's almost no flow convergence zone here. As a matter of fact, the entire jet is very, very small, so the correct answer is this one here. So you see, it's not so difficult to quantify mitral regurgitation. Okay, to determine if regurgitation is mild or mild to moderate might be a little bit of a problem, but it's not really relevant, at least not in most of the clinical situations that you deal with. One last comment when it comes to quantifying mitral regurgitation. Not infrequently, you run into a situation where you image a patient and you judge regurgitation, let's say as moderate or mild, and then the patient comes in after some time again and someone else images him and then comes back with the finding that the regurgitation jet is larger than you quantified it. And then you've always run into the issue of who is wrong and who is right. The truth is that regurgitation, as no other form of valvular heart disease, can change its severity quickly. Here's an example that demonstrates that. A patient who was on chemotherapy, and the 2 top images show the echo that was performed during chemotherapy, probably due to some subclinical form of left ventricular dysfunction, and maybe even to volume overload. This patient now has relatively severe mitral regurgitation. Clearly there's jet here and here. And then after only 5 weeks, the patient came back and almost no regurgitation was seen. So keep this in mind. Regurgitation is something, especially in functional regurgitation, that comes and goes. The topic of mitral regurgitation is a pretty large one, and I think we should stop here for now, but we'll come back because in the next chapter I want to show you some additional things. I want to show you how to look at the mechanism of mitral regurgitation, look at specific diseases which can cause mitral regurgitation, what the consequence for the ventricle is, which therapeutic strategies there are, and I also want to show you a patient.